Warts on the neck, how to remove them. Tips from a dermatologist. Today in this video, learn the tips from Dr. Marino, a dermatologist, on how to remove warts effectively. After extensive research into the best methods for removing warts, we found that Dr. Marino's tips are the most effective. You're going to love them and find them incredibly helpful in getting rid of warts quickly. Let's get started. What are fibromas, often mistakenly called neck warts? 1. Difference between fibromas and warts. Fibromas, also known as soft fibromas, are benign skin growths often mistaken for warts. Unlike warts, which are caused by the human papillomavirus, HPV, fibromas result from mechanical friction and other non-infectious factors. They commonly appear in areas where skin meets skin or clothing, such as the neck, armpits, and eyelids. This distinction is critical, as it affects treatment options and associated risks. Second common causes of fibromas. Fibromas can be triggered by various factors, including hormonal changes during pregnancy or metabolic conditions like diabetes and insulin resistance. Additionally, obesity, overweight, and natural aging can promote their development. These risk factors increase friction and skin irritation, creating conditions favorable for fibroma formation. 3. Appearance and characteristics. Fibromas are pedunculated skin growths that protrude from the skin surface, typically ranging from 1 to 6 millimeters in size. They are usually the same color as the surrounding skin, but can also appear slightly darker. These benign growths are soft and mobile, distinguishing them from other skin lesions like moles or warts. 4th, clinical diagnosis. Diagnosing fibromas is straightforward and involves a clinical examination. An experienced dermatologist can often identify fibromas with the naked eye, eliminating the need for invasive biopsies. This quick and non-invasive method, often referred to as a clinical eye, provides a safe foundation for subsequent treatment. 5. Cosmetic and medical significance. While fibromas are harmless and pose no risk of malignancy, they can be cosmetically bothersome or cause discomfort, particularly in areas prone to friction. Many patients choose to have them removed for aesthetic or practical reasons. According to a study published in the British Journal of Dermatology, patients often seek treatment to reduce irritation or the risk of secondary infections. When and why should fibromas be removed? Functional and cosmetic reasons for removal. Fibromas are generally harmless but can cause discomfort when located in high-friction areas such as the neck, armpits, or groin. Clothing, jewelry, or even movement can irritate these growths, leading to inflammation, redness, and sometimes pain. Aesthetic concerns also play a significant role, especially when fibromas are visible on areas like the neck or face. Symptoms that warrant removal. Fibromas should be removed if they cause itching, burning, or other unpleasant symptoms. Constant mechanical irritation can not only reduce quality of life, but also increase the risk of secondary infections. For instance, necklaces that repeatedly rub against fibromas on the neck can cause chronic discomfort and inflammation. Risks of self-treatment. Using home remedies or aggressive methods to remove fibromas can pose significant risks. Tying them off with threads, a common but improper method, often leads to necrosis, tissue death, at the base of the fibroma, causing inflammation and infection. Similarly, using acids or miracle cures marketed online can damage healthy surrounding skin, resulting in pigmentation changes or scarring. Medical benefits of professional removal. Professional fibroma removal by a dermatologist minimizes risks and ensures the best cosmetic outcomes. Modern methods such as electrocoagulation or surgical shaving offer precise results and significantly reduce the likelihood of scarring. According to a study by the American Academy of Dermatology, proper treatment reduces the risk of complications to a minimum. Prevention and dermatological advice. Patients should seek professional removal and consult their dermatologist for tips on preventing future lesions. Dermatologists can provide personalized advice to minimize friction and irritation in affected areas, such as choosing appropriate clothing. Regular skin checks can also help detect new skin changes early and treat them as needed. Professional methods for fibroma removal. 1. Electrocoagulation, precision and efficiency. Electrocoagulation is one of the most effective methods for removing fibromas. It involves grasping the fibroma with a fine tweezer and using an electrocautery device to burn it off in a controlled manner. This technique is precise and typically leaves minimal scarring. By sealing blood vessels simultaneously, it reduces the risk of bleeding, making it especially suitable for small to medium-sized fibromas. 2. Shaving technique, quick and simple. The shaving technique involves removing the fibroma at its base using a fine surgical tool, such as a Castro Viejo scissor. This method is particularly effective for larger fibromas and often involves the use of local anesthesia. The benefits include quick healing and immediate treatment of the wound to prevent infection. Experts note that this technique often results in barely visible scars. 3. Cryotherapy, freezing fibromas. Cryotherapy uses liquid nitrogen to freeze the fibroma, causing the tissue to die and the fibroma to fall off within a few days. While effective, this method carries a risk of pigmentation changes, particularly in individuals with darker skin. For cosmetic reasons, dermatologists often prefer electrocoagulation or the shaving technique over cryotherapy. 4th, pros and cons of treatment methods. The choice of method depends on the size, number, and location of the fibromas, as well as the patient's individual needs. Electrocoagulation and the shaving technique are preferred options due to their precision and minimal side effects. While cryotherapy is less invasive, it can result in unwanted skin discoloration. All these procedures should be performed by a qualified dermatologist to ensure optimal results. 5. Importance of aftercare and prevention. Proper aftercare is crucial to ensure good healing after fibroma removal. Patients should keep the treated areas clean and protect them from intense sun exposure to minimize the risk of scarring or pigmentation changes. Dermatologists also recommend regular skin checks to detect new fibromas early and implement preventive measures such as reducing friction. Why home remedies and advertised products are problematic. Risks of home remedies and false advertising. Many people resort to home remedies or advertised miracle cures due to cost concerns or misinformation. Using acids or chemicals designed for wart removal on fibromas can lead to skin damage, such as burns or pigmentation changes, and harm the surrounding healthy tissue. The failure to distinguish between fibromas and warts exacerbates the risk of improper treatment. Dangers of self-treatment. Methods like tying off fibromas with threads can cause severe complications. Cutting off blood flow to the fibroma can result in tissue necrosis, death, increasing the risk of inflammation, infection, and scarring. These practices highlight the dangers of attempting medical treatments without professional guidance. Why professional treatment is essential. Fibromas should only be removed by dermatologists. Professional methods like electrocoagulation or the shaving technique ensure precise results while minimizing side effects. Dermatologists not only remove the fibroma, but also protect the surrounding skin, significantly reducing the risk of infections or cosmetic issues such as pigmentation disorders. Patients also benefit from accurate diagnoses and personalized aftercare recommendations. Final advice: caution with over-the-counter solutions. Products marketed for wart removal are unsuitable for fibromas and should be avoided. These can lead to improper treatments, increasing the risk of long-term damage such as scars or skin discoloration. Always rely on the expertise of a dermatologist to ensure safe and effective treatment. Regular skin examinations can help identify new fibromas early and take appropriate action. Proper fibroma treatment requires knowledge and care. Avoid risky home remedies or misleading advertisements, and trust a dermatologist's expertise to ensure the best results for your skin health and cosmetic appearance. If you enjoyed this video and want to learn more about skin health, subscribe to my channel, hit the bell, and leave a like so you don't miss any new videos. See you next time. Stay healthy.